Hi, Mr. Friesen. My name is Jennifer, and I'm your nurse today. I'm here to get you ready for the examination with the doctor. Can you state your full name for me
Christopher JFriesen,
and your date of birth?
January 1, 1990.
Excellent. Can you tell me the name of this building that we're in?
The Harry S. Truman Memorial Hospital.
Okay, and why are you here with us today?
My annual exam. I had brought my baby, so that's what you hear in the background.
Okay, thank you. That's perfectly fine. And what is today's date?
January 1, 2019.
Sure. All right. Well, thank you so much. I saw you walk in here earlier and you looked like you felt pretty steady on your feet. Did you feel comfortable standing and walking?
Yes.
Do you ever use a walker or wheelchair or cane?
No.
All right. This is my hand stuff. All right. So do you have any wounds or bruises, lacerations, sore areas, areas of redness, or any other concerns to your skin that you would like us to check out while you're here today?
I scratched my arm on a tree branch the other day. I washed it with H2O2 and applied salve,
Like
Neosporin, and covered it with a Band-Aid.
Okay. Do you mind if I take the Band-Aid off and have a look?
By all means.
All right, I'm going to take off a little bit of hair here. I apologize about that. All right, that actually looks like it's healing really well. Unless the doctor tells you otherwise, I'm going to suggest that you stop using that hydrogen peroxide. You can keep using the Neosporin if you want, and you don't have to keep a bandage on it. Just keep it clean and dry, okay?
Okay.
All right, I'm going to measure this and take a look at it. Does it hurt when I touch like this?
No.
I see that it's just slightly pink along the edges of the scratch. That's normal. If it turns any more red than this, if you notice swelling or if you start feeling feverish, then those are all concerns that you would definitely want to come back to your provider for. Do you have any questions about that?
No.
Excellent. All right, so we're going to start out with an inspection of your head and face. So you're going to feel me running my hands through your hair. All right. All right, sorry if I messed up your hairstyle a little bit. All right. You ever notice any clicking or pain when you open or close your mouth?
No.
Would you open your mouth wide for me and close it and move your jaw forward and back? All right, thank you. You have any pain to your sinuses?
No.
Any pain when I press like this?
No.
Next thing I'm going to do is going to take a look at your eyes. There it is. So I want you to just keep a straight eye straight into my eyes, okay? And actually get a good shadow there, so that's pretty nice. I'm going to be really mean and shine this light in your eyes a few times. Good. All right. Next thing I'd like you to do is just take a look at the end of this light. Without moving your head, just follow it when I move it, okay? Excellent. Good job. Thank you. Next thing I'm going to have you do is, can you see my hands?
Mm-hmm.
See my fingers wiggling right now?
Yes.
Okay, I just want you to tell me what numbers you see when you see them, okay?
2, 3, 4, 5. 2, 3.
Excellent. Thank you. All right. Have you had any tenderness to your ears?
No.
Have you noticed anything coming out of your ears?
No.
Have you had any problems recently with changes to your hearing or people complaining that you can't hear them?
No.
All right. I'm going to take a look in your ears. You're just going to feel me grabbing them a little bit. Okay. Any tenderness when I pull on your ear?
No.
All right, I'm going to stand behind you, and I'm going to say a couple of numbers. I just want you to tell me what number it is that you hear me saying, okay?
Okay. 2, 4, 15, 27.
Thank you. Excellent work. Have you had any pain to your nose or swelling, soreness?
No.
Any difficulty breathing through your nose?
No.
All right, I'm going to touch your face again. Okay, can you take a deep breath in? Good, and another breath in. All right, you don't have any kind of swelling or anything? Any problems with your breathing?
No.
Do you have any history of any issues with your breathing?
Oh, I had a rhinoplasty in December of 2014.
Okay, how do you feel like that went?
It went well.
Have you had any problems with bleeding or swelling or pain since then?
No complications.
Excellent. All right, the next thing I'm going to do is take a look inside of your mouth. I'm going to use this blade here. Well, we call it a blade. It's like a popsicle stick to kind of flip down your lip, okay?
Okay.
Do you use any kind of tobacco products?
No.
Excellent. All right. This part feels a little bit weird. I'm going to have to actually reach in your mouth, and I'm just going to feel the inside of your lips. Have you noticed any sores or raw areas in your mouth recently?
No.
All right, open your mouth. Okay, and just let it kind of hang loose. I'm going to feel around inside of your gums. The little one's got the hiccups.
Mm-hmm.
All right, while I'm in your mouth, I'm going to use this piece of gauze and just kind of grab your tongue. If you could stick it out for me. Thank you. All right, you can have your tongue back. All right, I need you to open your mouth wide, stick your tongue out far, and say ah.
Ah.
All right. Sorry to gag you a little bit there,
Mm-hmm.
but that's good. That's normal. That's what we want is for you to gag when we touch the back of your throat like that. All right, so I'm going to be touching your face again, your neck, and just checking your lymph nodes. Any cold or flu symptoms recently?
No.
Any difficulty swallowing or noticing any swelling?
No.
All right. Any problems turning your neck back and forth or notice any soreness to your neck at all?
No.
All right, if you would go ahead and grab that bottle of water that we brought you. Okay. All right, and go ahead and take a sip of that for me. I noticed from your record that one of the medications that you take is levothyroxine. Is somebody following you with regards to your thyroid?
Yes.
All right, I noticed a little bit of swelling. Has that been checked out?
Yes. My primary care physician gave me an MRI.
All right. I'm going to take a listen to your neck now. You don't need to do anything, but just breathe normally, okay? All right, everything sounds really good. This one I'm going to ask you to remove your shirt for me, please. Thank you. And let me take a look at your hands. All right. You can take a deep breath in and out for me. Good. I'm going to have you do the same thing again. Nice deep breath. And I'm just going to be taking a listen to some different fields on your back. Every time you feel the stethoscope touch your back like this, I'd like you to take a nice deep breath in and let it right back out again, okay?
Okay.
All right, and go ahead. All right, I'm going to do the same thing here at the front now. I'm going to start with your neck and move down. Deep breath in. All right, you can go back to breathing regularly for me. All right, you're going to feel me pat your back. Let me know if you feel any tenderness.
Okay.
All right. All right. And take a look at your hands again. You said that you don't smoke or use any tobacco products, correct?
Correct.
Fantastic. All right. You could do me a favor with your hands. Just let them hang at your sides. Reach up over your hands, over your head, and touch your hands. Okay, and back to the middle. And reach in front and back. All right. Don't let me push down. Don't let me push up. Oh, man.
It's fine.
All right. Don't let me push back. Okay, hold your hands like this in front of you. Don't let me pull. Don't let me push. Okay, hold your hands like this. And back. Give my fingers a squeeze. And release. Oh, honey. All right. I'm going to have you go ahead and lay down for the next couple of parts of the assessment. Have you had any chest pain?
No.
Unexplained fatigue or feeling like your heart is racing or pounding?
No.
All right. We'll take a look at your chest here. All right. When was the last time that you had a bowel movement?
Yesterday?
Okay. And have you had any unexplained weight loss recently?
No.
Have you had any problems with eating or toileting?
No.
Just going to take a listen to your abdomen. Okay, I'm going to listen again. This time I'm going to get really close to your belt line for just a moment. All right, this might tickle a little bit. You're going to feel me touching the belly. Let me know if you notice any tenderness. All right, I'm going to do the same thing again. This time I'm going to push a little harder, okay?
Okay.
All right, thank you. I'm going to feel the pulses in your feet. Do you ever notice any numbness or tingling to your feet or lower extremities?
No,
And I notice you don't have a whole lot of hair down by your ankles. Do you wear boots for work?
I do.
All right, now we're going to do some acrobats. You can stay laying there in the bed. The first thing that I'm going to have you do is pull your left leg up to your chest. Good. Extend your leg a little. Okay. Can you point your toe? Pull it up towards you. Good. Extend that leg back down. We're going to do the same thing with the other leg. Pull your knee up. Extend the leg. Point your toe up towards your head and push down on the gas. All right. Thank you. All right. If you could go ahead and have a seat again. Okay. All right. So close your eyes for me. Let me know when you feel something touching your face.
Yep. 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 Yep.
Excellent. Okay, keep your eyes closed. I'm going to move your finger. I want you to tell me if it feels like I'm moving your finger up or down.
Up. Up. Down. Up.
We're going to do the same thing over here.
Up. Up. Down. Up.
Good. All right, you're either going to feel something sharp, like you're being poked, or you'll feel something dull. Either way, it's not going to hurt. I just want you to say sharp or dull.
Dull.
Okay, that's actually the sharp. That's as sharp as it gets.
Oh,
And this is the dull.
no, dull.
Okay, you feel the difference?
Yep.
Okay.
Dull. That's dull. First one was sharp. That's the sharp. That's the dull. Dull. Sharp. Dull. Sharp.
down here.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Hold your left hand out in front of you. Keep your eyes closed. I want you to tell me what's in your hand.
Key.
Good. Okay, we're going to switch hands. I want you to tell me what's in your hand.
Coin.
Excellent. All right. Reach your left arm out to your side. Touch your nose. And back out. Now switch and do that with your right. Good. Use your left foot to touch your right shin. Okay, good. And use your right foot to touch your left shin. All right. I want you just to relax your leg. Just let it hang. Okay, and you're going to feel me do something to the bottom of your feet. Just let your leg relax. Sorry, I know that tickles. Good. All right, the last thing we have is basically just a question and answer. Okay? You're welcome to hold your baby now if you'd like to.
Oh.
Are you urinating regularly?
Yes.
About how many times a day?
4 to 8.
Okay. Do you wake up frequently at night needing to urinate?
No.
Do you ever have a hard time starting or stopping the stream of urine?
No.
Do you ever have pain with urination?
No.
Excellent. Have you ever had a sexually transmitted disease?
No.
Have you had any pain or recent changes to your genitalia or your sexual or urinary form or function?
No.
Okay. Do you perform regular testicular self-exams?
Yes.
Okay. So we're just going to talk about that briefly. The best place to do a testicular self-exam is in the shower. You want to be warm and soapy. You want to feel your testicles, and they should feel about the size and shape of an egg. They should have about the consistency of a hard-boiled egg. There's some softer tissue called the epididymis that sits on top of it. They should be freely mobile, but you shouldn't twist them or turn them or pull them or anything like that. If when you're inspecting you ever find a hard lump or you have any swelling or you have any changes at all, you want to contact your primary care provider at your earliest convenience or right away to make an appointment as quickly as possible. Do you have any questions regarding that?
No.
All right. Well, thank you so much for your time. I'm going to step out and the doctor will be in with you shortly.
Thank you.